As far as oral regimens and adherence, I think that's going to vary with patients. Patients all think they want to do oral medications. And when they're on a clinical trial, it's easy to monitor, right? Because they bring in those diaries and you know if they've taken their medications. But with the oral regimens, it's easy to skip a dose, or I didn't feel good, or I had company this day, or I'm traveling and I know I don't want to have to worry about diarrhea associated with lenalidomide, for instance. So it can be a problem, but I think if we have good relationships with our patients and we're talking to them, if they're having side effects that make them want to hold those drugs, we want them to call us and let us know. There are times when you do choose a regimen, if you have a patient that you just know they're not going to take this or it's causing too many side effects, then we may choose a regimen that brings them in so we know that they're getting the drug. But these are all conversations with the patients. You're weighing the pros and cons. We have some patients that just really do not want to come to the infusion center. And if we're able to give them a regimen that works just as well, then we will go that route for them. And it's typically, again, more pills. If you look at, just to use venetoclax, for instance, they're 100 milligram tablets, and those patients take 8 of those pills a day. And that's just that piece of it, not counting the supportive care medicines that go with it. So oral is not always easier. And I think sometimes, patients maybe don't always take into consideration how potent that oral dose can be. Exasamib, you're getting a big dose in that one pill that you take once a week. So they're still quite powerful, and we have to educate our patients on that.
When patients are on multi-drug regimens of various different routes of administration, I think that there are a lot of different strategies that we can use. I think it is very patient specific. Some patients are very much on top of it and they never miss anything. Other patients need a little bit more guidance. I think there's some strategies. So for oral medications, for example, the ones that are just once a week, like ixazomib, it's hard to remember to take something when you're only taking it once a week. So I encourage patients to set alarms if they use calendars. There are some specialty pharmacies now that are making pill bottles blink when it's time for the next dose. So we've had patients specifically request, can I please have the bottle that blinks? So I think there's some different tools and strategies that we can talk with the patients about. And then I just always make sure that they know what they're getting in the infusion center and what they're responsible for taking at home. So if they're coming in for their bortezomib injection, are we giving them their dexamethasone here as well, or are they going to be taking that at home? So just communicating well and really relying on a lot of our nursing colleagues to help with that multidisciplinary approach.
With oral medications on top of having IV and subcutaneous medications as part of a regimen, one of the things that we see, for example, with our lenalidomide is because it has to be shipped to the patient, they might not have filled out their survey in time, and maybe it's a day or two late. Sometimes that can throw patients off if their calendar says start on the 6th, but the medication doesn't get there until the 7th. So we've actually had a few patients miss doses that way or tack them on to the beginning of the next cycle. And I think it's really important, especially with the immunomodulatory drugs, to have that 1 week break. So kind of leaning on that a little bit. I think it's also challenging for patients to remember, okay, I take this medicine every day for 3 weeks and then I have a week off, or 2 weeks and then I have a week off. I think that can be a little bit challenging just to remember to take that week off. But it all kind of comes back to counseling and just figuring out what works best for the patient. Sometimes we have to call and remind them too.
I think that's a good point. We will call patients that have started new regimens as well, one, to see how they're doing with it, but just to make sure that they understand how they're taking those new medications.